2.
With the bag valve mask, you want to look for any leaks. So to do this, you need to try and inflate the bag while sealing it off. This will show any leaks present. You then want to also fill up the reservoir to make sure that it also doesn't have any leaks. So you want to then assemble the bag. So to do this, the reservoir and also the mask, like so. And you also then want to attach the bag valve mask to running oxygen. So you'd want this to be running at a minimum of 10 litres per minute. So you want, and then whilst that's occurring, you want to assess if the reservoir is filling up. So I want to put this on to 10. So I can see here that the reservoir is starting to fill up, which shows that there is no leaks. So I also then want to perform a head tilt maneuver to open up the airways. You then want to insert an OPA or an MPA, so in this case I'm going to insert an OPA. So you want to measure this to your patient from their mouth to their mandible, and so you want to measure it and see if it's correct size and insert it at 180 degrees. Like so. So you want to twist and it should fit in like so. So you want to then fit the mask on the patient's head the correct way up, so that's the head in first, then the nose. So I'm going to do this like so. And since I am a single user, I'm going to be using the CE grip to ventilate the patient every 5 to 8 seconds. So every time I ventilate, I want to check for chest raises and gastric inflation. So there, when I ventilated, the chest rose, and that is what I'm checking for. For gastric inflation, you want to put pressure on the anterior and posterior cricoid ring, which is on the larynx, roughly located where the Adam's apple is, and this moves the trachea posteriorly and compresses the esophagus to prevent aspiration and gastric inflation. So generally, a second user would be doing this, and you also want to use the MOANS acronym to assess the effectiveness of the bag valve.